ABC 30 Valley Spotlight is sponsored by Kaweah Delta Medical Center.
Most cardiac catheterizations are done to assess coronary blood flow. That is, do you have blockages in your blood vessels of the heart that can cause you and your heart problem moving forward? When it comes to invasive procedures, currently there are two types that are being done mostly. One is transfemoral, which basically the physician, your cardiologist, gets access through your leg, and through that catheters go up and look at the blood vessels that feed in the heart. Currently, most academic centers, they train their fellows, which become cardiologists in the future, to go transradially, getting an access through the radial artery. When you go to your physician, they feel for your pulse, that's your radial artery. So that's basically, instead of going to the groin, go to the arm, they do that. What sets us apart at Kaweah Delta is, part of it is this unique relationship with Cleveland Clinic, which is the top cardiovascular program in the nation. As physicians, we always want to look at the risk. Are there ways we can mitigate these risks? Transradial approach, thankfully, eliminates risk of bleeding in patients and life-threatening bleed, which is even more of a concern. This is the size of needle that is used for leg access versus this what we use to get access in the arm. As you can see, it's much smaller for the arm, so it will be less traumatic, decreased risk of bleeding and damage to the blood vessel. As far as recovery time, it's much less on the patient, as well as patient's discomfort level is much less. When you go to a groin, a patient needs to sit laying down for at least 4 to 6 hours. That in itself can cause problems for patients who, let's say, are overweight or have back issues, that you have to sit in a certain position or lay down for a certain position for a long period of time, and that can cause pain and discomfort. Through arm, that sort of is eliminated. One of the biggest benefits of it is that patients can be discharged same day, even after intervention. It's better for the patient, it's better for the hospital system, and it's better for cost to society.
We now have our open heart patients come in to meet us the day or days before surgery, and during that time we do their education about what to expect for surgery. We have them meet an anesthesiologist. We really help them understand what the whole process will be. This is done on a one-to-one basis with a registered nurse. We guide them through their labs, their pre-procedures that all need to be done, which can be so overwhelming to someone who's going to be having open heart surgery. This allows them to spend their last night before surgery at home with their family, which is where they really want to be, where they're most comfortable. They come in the morning of surgery, we have them prepped for surgery, and they go in.
Working diligently with the Cleveland Clinic, we have created a same-day discharge process for all of our patients that have either received a stent or have received new devices inserted that day. Biggest benefit for the patient to go home the same day is sleeping in your own bed, feeling safe, feeling well taken care of, being comfortable. Those are things that patients look for.
At Kaweah Delta, would always place patient care at front of our own agendas.
ABC 30 Valley Spotlight is sponsored by Kaweah Delta. More than medicine, life.